Okay, this recording is going to go through the various aspects of the thorax that you want to be considering with a chest x-ray and with other forms of chest or thoracic imaging. So some of the key spinal levels in the thorax that I just want to remind you guys about is, remember that you have the sternal angle, which is going to be located at the intervertebral disc between T4 and T5. So keep in mind there's going to be a little bit of anatomical variability there, but in general, the arch of the aorta is going to begin and end at the T4, T5 spinal level. And so again, that's going to be right where the manubrium meets the body of the sternum. And then we have up here where you can see at the level of T3, that's going to be at the approximate location of the where the first rib is joining with the body of the manubrium. So again, keep that in mind. T3 is that level where you should expect to see the first rib joining in with the manubrium of the sternum. And then finally down here you can see at the T9 spinal level, so this is going to be the approximate location of where the heart is sitting on top of the diaphragm, so the base of the heart, and then also the xiphosternal joint is going to be located at approximately at that level. So again, those are some key spinal levels to keep in mind when you're reading chest x-rays and looking at CT scans of the chest. So another name also for the sternal angle is the transverse thoracic plane. And so again, just something to keep in mind. Remember that the arch of the aorta then, when you can see that pretty well on most images, and so that's typically going to be at approximately the T4 spinal level, give or take, up or down a little bit from there. And so just looking at this on an anterior view, so this is the same image that we looked at a moment ago. And so once again, you can kind of appreciate these same landmarks here on an anterior view. So again, nothing new there. Lung fissures are a feature that you can actually appreciate in some cases on chest x-rays. Keep in mind that in some individuals these are invisible, and others you can see them. But generally, the reason it's important to look for them is in certain pathological conditions, you'll actually see an expansion of the lung fissures. And so we'll look at that here in a little bit. But just to remind you, remember that you have two fissures on the right lung, two fissures on the right lung and one on the left. So on the right, you have the horizontal fissure, which again you can see coming across right here, and then the oblique fissure is the larger one. Again, you just have the one oblique fissure over here on the left-hand side. And then looking at a posterior view again, lateral view here, you can see the oblique fissure continuing across with the horizontal fissure coming off of it and outlining then the middle lobe of the right lung. And then on the left lung, you can just see that oblique fissure coming across right there. And then just to kind of remind you of some of the relationships of the lungs to the mediastina and the various structures located within them. And then looking over here at this image, looking at the approximate vertebral levels where both the parietal pleura as well as the lungs are located at rest when you're not breathing in or inhaling or exhaling, but just at rest. These are the approximate levels. So just a good thing to go back and review, because these can be really helpful when you're interpreting chest x-rays. And so before we move into the next slide, I'm just going to go back over here to complete anatomy for a minute. And again, I think it's just good to appreciate this in 3 dimensions. So I would recommend that you go into complete anatomy and just kind of look at where these fissures are located in relation to other structures. So again, this is just obviously an isolated view, but I think where it really helps you appreciate things is if you look at a view like this, where you have other structures in the thorax shown. And so here I have the middle lobe of the lung outlined, just so that you can get a little bit better sense of the horizontal fissure and then the oblique fissure, and you can kind of get a sense of where these are located. So you can see, obviously, you can just count down the ribs, but this is the 4th rib right here. So the 4th rib is the approximate location of the horizontal fissure, whereas the oblique fissure usually is coursing somewhere around the location of the 5th intercostal space, so in between the 5th and 6th ribs. So again, you can kind of see that. Usually it's ending right about the level of the 6th rib, but you can see it cutting across the 5th rib as it's descending there. And then you should be able to see the same basic pattern over here on the left-hand side as well. So again, between the 5th and 6th rib. And when you see that on a chest x-ray, that the oblique fissure or the horizontal fissure, usually it's just going to look like a very thin line, like it was drawn by a really sharp pencil across the image. So then coming back to the mediastina, so remember that you have superior and inferior mediastina, and then within the inferior mediastinum, we break that up into anterior, middle, and posterior mediastina from there. And so obviously in the middle mediastinum, that's going to be where we have the heart. So you want to make sure you keep in mind the important anatomical relationships within the mediastinum. And so the relationships there are going to be thinking about the orientation of the heart, as well as the great vessels that are coming off of the heart and going back into the heart as well. So keep in mind, make sure that you review these various structures. The way that the arch of the aorta is coursing up and over the right pulmonary artery, which you can see coming across right here. And you can kind of see its close relationship on the left-hand side over here with the left pulmonary artery. So you can see that quite well on imaging, that you'll see this sort of what we call the AP window right here, which is going to be the window, sort of this concavity that you have in between the aorta and the left pulmonary artery. Keep in mind also the various structures or the borders of the heart. So the left border that you'll see on imaging is going to just consist of a small part of the left ventricle. The anterior surface of the heart is primarily the right ventricle, and you'll be able to appreciate a little bit of the right atrium on imaging as well, but that's going to appear quite a bit lighter than the rest of the heart. So you should be able to appreciate that, and as well as its convexity over here as well. And then obviously your superior vena cava and inferior vena cava. Superior vena cava tends to be relatively easy to appreciate on chest x-ray. IVC tends to be somewhat more challenging. And then coming back to the aorta, you want to make sure you remember the major vessels coming off of that, so the brachiocephalic trunk, and then the left common carotid and subclavian arteries in that order. So make sure that you have those really clear. And then note the relationship between pulmonary arteries and pulmonary veins. The pulmonary arteries are located superior to the location of the pulmonary veins on the posterior aspect of the heart. So again, keep these relationships in mind. Again, you can come back to complete anatomy. I think it's really good to try to appreciate that on here. Again, you can sort of zoom in and look at these various structures on the model. You can obviously see your brachiocephalic veins coming together to form the SVC. You can see the aorta and its branches with the brachiocephalic trunk giving off the right common carotid and the right subclavian, and then again the left common carotid artery as well as the left subclavian artery there as well. And then if you sort of loop this back around, you should be able to appreciate the relationship of the pulmonary vasculature, so the pulmonary artery and vein. So the pulmonary vein you can make out in blue there, with the pulmonary arteries in red right below it. And then also you can see the trachea where it's bifurcated and forming the left main stem bronchus and giving off the secondary bronchi from there. So again, good thing to sort of play around with and make sure that you're really comfortable with the three-dimensional relationships of these structures to each other, and especially with the bony structures too. Always pay attention to the bony structures, because those bony landmarks are going to be really valuable when you're looking at imaging. One other thing that I wanted to point out, which I'm going to fade away the middle lobe of the lung for a moment. Notice the hemidiaphragms. So you have the right hemidiaphragm here and the left hemidiaphragm over here. Notice that the right hemidiaphragm is higher or located more superiorly than the left. That's totally normal, expected to see that on imaging, and the reason for that is due to the presence of the liver over here on the patient's right-hand side. All right, so here's some other images that'll help you with the relationships of the great vessels within the mediastinum. Next week we're going to be talking about cross-sectional and other projectional images of the thorax. So I would highly recommend that you review these in preparation for those lectures, because that's going to really help you when you're trying to look at a cross-sectional view or a sagittal or coronal view of the thorax, to be able to understand the relationships of these different vessels and other structures to each other when you're trying to interpret those. Here's another view of the superior mediastinum. So you can see obviously the thymus up here has been removed in the lower image, just so that you can better appreciate the brachiocephalic veins forming the SVC. You can obviously see the arch of the aorta right here, and then its major branches, those great vessels coming off of it from there, being the brachiocephalic common carotid and subclavian arteries. Another view, again, trying to remind you of some of these important relationships of the great vessels to each other, where you can see the pulmonary trunk, the arch of the aorta, SVC, and then also the brachiocephalic veins. Down here, this is a good reminder about the azygous vein or azygous vein. So remember that the azygous vein is going to be dumping into the SVC. So usually you'll see a little bit of a sort of a conical shaped outpouching on the SVC, and that's going to be the location of the arch of the azygous vein and where that's dumping into the superior vena cava. So again, another great landmark that we'll talk about later on chest x-ray. Another image here where we've now removed the great vessel so that you can appreciate the trachea and the tracheal bifurcation. So remember, this is the carina, which is going to be located at the sternal angle or the transthoracic plane. So you can obviously appreciate then the more vertical orientation of the right main stem bronchus versus the more horizontal and longer orientation of the left main bronchus, as you can see right there. And then you can appreciate the relationship of the pulmonary arteries and the pulmonary veins relative to the bronchi. So again, things that you want to make sure that you review. And this image over here on the left, you'll notice the green kind of grape set of grapes around the carina. That's going to be the tracheobronchial lymph nodes that are located there. There's a fairly large number of them, so if somebody does have like a lung tumor or other adenopathy type condition, and those lymph nodes are going to be quite enlarged, and you'll be able to pick them up on imaging. So kind of keep that in mind, that's a good place to pay attention to when you're looking at a chest x-ray. Other relationships that you want to think about is lateral views. So looking at the mediastinum, so over here, this is going to be a view of the right side of the thorax, and so we've just removed the right lungs so that you can appreciate what this all looks like. So you can see the azygous or azygous vein coming up, arching over the right bronchus to dump into the SVC, which you can see right there. So, and then this is going to obviously be the hilum of the lungs, so you can see the various components of the hilum right there. Looking over here on the right hand side, so this is a view of the left hemithorax. And so once again, you can appreciate the hilum here in the middle. You can see the arch of the aorta, the descending aorta or thoracic aorta located right there, and you can see a couple of the great vessels coming off of the arch of the aorta as well. So the left common carotid and left subclavian arteries are shown right here and right here. And then of course you can see the brachiocephalic vein coming down to eventually join up with the right brachiocephalic vein to form the SVC. And so you can see a little bit of the kind of the outline of the heart right here as well. But in general, when we do a chest x-ray, we are usually looking from sort of this view here. It's normally a left lateral view, so you're looking in this way, and so a lot of the structures over here on the left side, left hemithorax, are going to be sort of shadowed or overshadowed, so to speak, by the structures on the right side or the right hemithorax. And then finally, one of the other really important relationships to keep in mind when you're looking at a chest x-ray is the orientation of the heart. So I talked earlier about the what structures you see where. So again, the right border is where you'll see the right atrium. And the anterior surface is primarily the right ventricle. You'll see just a small small portion of the left ventricle, but that forms the left border of the heart. So right ventricle and left ventricle both combine to form the inferior border of the heart. You can see the apex over here on the left-hand side of the chest, and then up here you'll notice that usually you don't really see much of the left atrium on imaging, though obviously you can appreciate the right atrium quite well. So keep that in mind, that you really can't see the left atrium well on an AP or a PA chest x-ray. So then, just remind yourself of the normal relationships of the hyla. So again, you can see the main stem bronchus as well as the pulmonary arteries and pulmonary veins on the right, and then down here on the left, you can see once again pulmonary artery, pulmonary veins, and then the main stem bronchus. So again, with that, I would highly recommend that you check that out over here on the complete anatomy setup, just so that you can sort of be reminded of what these important relationships are here with around the hilum. And so when you're looking at this on imaging, one of the things to look for on a lateral view is you'll see sort of a dark, I call it the dark eye, that you'll see right in the middle of the hilum. That is going to be representative of usually the left main stem bronchus. All right, and then finally the lungs and the pleura themselves, so you want to check them out as well. And typically on a chest x-ray, what you'll see is a sort of these white streaks throughout the region of the lungs. Those streaks represent the pulmonary arteries and veins. It's really you really can't differentiate between pulmonary arteries and veins, but you can definitely see their presence on a chest x-ray. So you want to make sure that you can see that symmetrically on both sides of the body, and you'll notice that the vasculature is smaller as you move more apically in the lungs, and then towards the base of the lungs or more inferiorly, you're going to see much larger vasculature. So that's a normal pattern. That doesn't indicate anything abnormal, but that's one thing to just keep in mind. And then similarly, moving from medial to lateral, you'll see the same sort of pattern where these vessels are going to get progressively smaller and smaller as you move out further and further laterally. So you want to be looking for that. And then look for the pleural surfaces as well. You can oftentimes make out, if you look closely, you can make out these faint pleural surfaces. And so oftentimes if there's pathology, you'll notice a significant change there in the pleural surface, the relationships of the parietal to the visceral pleura. And I'll point out some of that stuff a little bit later on. And then in terms of soft tissue, you want to be looking for calcifications. Those can be normal. They can also be pathologic, but those are going to look like kind of these random bony or hyperintensities that you'll see. Mass effects, that's going to be where you have significant shifting of especially mediastinal structures and or overlying soft tissue. And then abnormal air collection. So if you see like a large patch of abnormal air collecting somewhere in the thoracic region, that obviously indicates some sort of pathological change that's going on there. One thing to keep in mind when you're looking at these things is I mentioned before that you want to have a systematic approach to reading a chest x-ray, and this goes for all imaging, but chest x-rays are notoriously difficult to interpret. And so a study that was done on this showed a study where there was a number of radiologists that were looking at scans of a chest x-ray, and a gorilla, which you can see here, came dancing across the screen and was displayed for a certain amount of time within a chest CT scan, and well over 75% of the individuals of the radiologists didn't even notice this gorilla dancing across the screen. So just keep in mind that it's very easy when you're focusing on one thing to miss other features of a chest x-ray. So, and again, same with other types of imaging. So you just want to keep that in mind. And then finally, just to review what we talked about in our lectures from Tuesday, is remember that there's 5 basic densities of conventional radiology. So remember, air is going to be radiolucent, so the lungs are going to appear relatively dark. Same thing with any parts of the airway. If you're looking at the trachea, the main stem bronchi, etc., you're going to be seeing this dark or radiolucent appearance to it, whereas bone and obviously metal as well is going to appear radio-opaque or radiopaque for short.